Hey guys, Dr. Casey Schneiber here, and welcome back to Movement Every Day. Welcome back to the channel, welcome back to the videos. Today we're going to do start a squat series. I talk about this to a lot of my patients, but a lot of people have questions all the time about certain squats, whether it's front squats, back squats, all sorts of squats. And they want me to watch their videos of how they squat, how they can improve. They want me to go to the gym with them. So I'm going to give you, in the next couple of videos, some very common mistakes that some of you already know, some of you may not know. So, and I'm not going to go much into detail. I've seen people go over squats in great length, and I'm not going to do that to you. If you really want, great depth and in great length, message me on any one of the social medias, and I'll get back to you. Or we can always just go to the gym and we can hash out for about an hour or so and just kind of learn how to do the movement, because squats are difficult. It's a big movement. So I'm going to get right into it, but today we're going to go over one of the most common things I see all the time, especially with women, is when your knees cave in inward, or that valgus stress. That's a very common term that's thrown around in the exercise world. So that knee going in, and when we push up. So I'm going to go over that. I'm going to get the camera in a different view, and we're going to get started. All right, guys, let's get started. So what does this look like with the knees going inward? So I'm just going to put a little bar on my back to act like I'm doing a back squat. So what the knee inward position looks like is if you get a good squat down, and then you come up, and your knees start to cave inwards, and you start to push like this. Or if you're down here and it starts right away, and your knees going inward, and you're trying to push up, okay? Now that's not what it's supposed to look like. What it's supposed to look like is this. You go down into a good squat, and then you come back up into a good squat. Knees are staying in the same plane. They're not going inward or outward. All right, some simple cues to make sure your knees don't go in. I take my feet and I corkscrew them into the ground. So basically, to exaggerate it, I'm turning my foot outwards without turning my foot outwards. So I'm kind of getting my toes spread out, and I'm really digging into the ground. And what I'm doing is that I'm activating these glutes back here, your butt muscles. So when you do this, and you rotate before you start, you rotate those knees and feet outwards, like you're trying to corkscrew. You'll feel your glutes activate, and that's what you want to feel throughout the whole squat. You never want to lose that tension back there, because that's one of the most important parts of this exercise that a lot of us are forgetting. So if you can do that, that usually cleans up a lot of it. So if I go like this before I prep my squat, I'll go like this. I'll go boom, and you'll see that little jerk in my knees, boom, because I'm activating these glutes, and I'm causing that external rotation of at the hips. And that way, you maintain it throughout the whole squat. You'll keep your knees in a nice outward position, and you keep doing that on the way up as well. Another big reason why your knees will cave in as you're pushing up is because you have lack of ankle dorsiflexion. I have videos out there. Remember, I showed you how to kind of increase your ankle dorsiflexion, or the ability to do this with your ankle and bend your tibia forward on your knee. If you can't do that, what's going to happen is your foot is naturally going to rock forward. So remember, go to those videos where you get on the ground and you mobilize the ankle. You can grab the band and just go to the video, and it will go over it for you there. It's simple. So those are two easy techniques and ways to improve and limit that inward stress of the knee. You know, if you do that, guys, you're going to hurt your knee over time. I mean, it is controversial out there right now, but I mean, for Olympic lifters, I'm not really concerned about it because sometimes it does create more strength, and I understand that. But for the average Joe, myself included, if you want to keep doing that, and if you have that inward stress, you're going to affect, your ACL, your meniscus, your ligaments around your knee, and that's going to cause knee pain eventually. So we have to stop doing that. And the simple cue of that outward rotation, or that corkscrew, activate those glutes, those external rotators of the hips. That's going to prevent those. Most of you will probably have some kind of tight adductors or tight inner thighs that's pulling that forward. So if we can counterbalance that with just a simple mental note before the squat, we should do fine. Another simple way before I end the video is if you want, you could take a band and like a stretchy band and put it around your knees, your thighs right here, and then you can externally rotate out and you can kind of see what that feels like because that band will pull you back in. So you can start to work on those external rotators, and then if you want, you can just do some air squats and you can go down and you can keep that band on that thigh area. It's a good way to kind of prep before a squat. I hope this helps. Until next week, I'm going to be throwing out some more videos of different flaws that happen in the squat. I'm not going too technical, like I said, so if you do have any technical or more advanced questions, let me know and I'll try to hammer them out with you. Until next week, and like always, remember, movement is everything and movement is life.